Hello, everybody, and welcome to another episode of the Raving Patients Podcast. As you know, I'm your host, Dr. Len Tao, and I'm super excited today. Today is the first episode of Season 5, so I want to wish everybody a Happy New Year. So Happy New Year, everyone. I hope everybody had a wonderful holiday season, and they're getting back to things in their dental office. Though hopefully the weather is not cold and frightful where you are. I'm recording from sunny Florida, as well as my guest who's also in Florida as well. But my guest today, and we're going to be talking about cybersecurity, HIPAA in your office. The title of today's episode is Security is an Investment, Not an Expense. And for those who know me and what I talk about, one of my quotes I give is that marketing is an investment, not an expense. So I thought that's a perfect title for what we're talking about today. So my guest today is Debi Carr, who is recognized as a leader in cybersecurity and compliance in the dental industry. So Debbie, Happy New Year, and thank you for joining me today.
Happy New Year, and what a great way to start the new year by getting your practice secure.
And we definitely need that. So as you know, as I told you before we recorded, I recently sold my practice to my associate, and I'm now an associate myself, working for my former associate. So a lot of the things that we're going to be talking about today may not be reflective for me, but I'm curious. I want to talk about it as if I'm the owner. I want you to treat me as if I'm the owner still, so I'll be able to answer the questions from an owner perspective, because I think it's really important that people who are associates who may be future owners know what they're going to be talking about or know what they need to do about their practice.
Absolutely, but you also have to remember that every person that is in the practice is a member of the team, right? And they are your first line of defense. Every person on your team needs to be aware of what security is, because they're the first line of defense. You never know when it's going to pop up. So whether you're an associate, an assistant, an owner, but yes, it all starts at the top as an owner. If you have an owner that really cares about the investments that he's put into the practice, then it's going to show and it's going to trickle down to his team. And so, as you said, marketing is definitely an investment, but security protects your investment that you've put into it. And so it's real important that we have those the right things in place, and we've been incentivized to do those now.
So for those that are not aware, and there's a number of people who not, I want to say do what you do. Everybody has their own niche in the industry, but for those that don't necessarily know who you are, why don't you kind of tell people who you are, what you do, what you're known for in the industry.
Okay, well, I am Debi Carr, and I'm with DK Carr and Associates, and we are a cybersecurity consulting firm. I've been in technology for over 30 years, actually 33 years. My husband, when I married him, was into technology, and it was either get with the program or we were not going to have anything in common. And 32 years later, we're still together. And so I worked in the dental industry for 25 years. And so in 2014, I took what I knew and combined them. Actually, in 2009, 2010, I started consulting, helping doctors to implement paperless practices. And my husband said, honey, people get paid for doing that. And so I started consulting on the side, still working in dentistry. And in 2014, realized that with the changes in the HIPAA law, that private practices were going to be left out and were going to have some issues. So I invested in education. I am now what they call HIMSS certified. So I'm a certified associate in healthcare information management systems. And I'm also ISSAC squared certified. So I'm a healthcare information security privacy practitioner. So I can go work in a hospital, but I love the private practice. I love dentistry. And it hurts me when I see them hacked. And I know that it was avoidable.
Gotcha. And if you remember, one of our first interactions that we've had was when you reached out to me because you wanted to know the security that Bird Eye had in place. And I'm not the owner of Bird Eye, as you now know, but you had reached out to me because you wanted to know what Bird Eye was doing for security with the stuff that we were doing for one of your clients. That was our first interaction a number of years ago. I think you were with, at the time, I think you were with Deborah Nash, and you were together when you reached out to me.
Yeah,
So,
well, I think if she was using you, so we do, one of the services that we provide is, as you know, that a risk analysis, or maybe you don't know as a practice owner, when was your last risk analysis?
I don't even, risk analysis, I'm not even sure.
Okay, so every practice under HIPAA is required to conduct a risk analysis every year. Most practices understand that they've got to do their annual HIPAA training, but where they fall short is they are also supposed to be doing a risk analysis that reviews the security position of the practice. And this is an area that most practices fail at. So when we are doing a risk analysis for a practice, we contact their vendors, their partners, because anybody who's touching your data is a security risk. And I want to know how you are protecting your information at the same level that we're trying to do it in the practice. So yeah, that was our first encounter.
Yeah, I still remember that. So, all right. So let's get into some of this content that we wanted to talk about.
Okay.
I know we wanted to talk about some of the changes that are occurring moving forward, especially for HIPAA, because I think there's a lot of things unknown with HIPAA completely across the board. One of the things is people don't even know how to spell the damn thing. I see online HIPPA. No, it's HIPAA. It's like, guys, get your spelling right. So let's talk about HIPAA and changes and creating a safe harbor.
Okay, so we were just talking about a risk analysis and the fact that most doctors don't know what they are supposed to do under HIPAA, HIPAA. But January 5th of 21, I was so excited. I was literally jumping up and down because I come at security from a security standpoint. So if you look at HIPAA as best practices, and that's really all it is they didn't reinvent the wheel and say, hey, let's go make doctors' lives complicated. They said, no, what is best practices that we can have medical or healthcare do to protect patient data? If you take credit cards in your office, then you have to meet what they call PCI. And you know about the PCI, right? Everybody gets those scans periodically. Here's the good news. It's the same requirements. It's just that HIPAA is a little more graceful than PCI is. PCI says you will, HIPAA says you might. And so it's really best practices. But on January 5th of 2021, a new an amendment to HIPAA went into play. And what it says is that if you can demonstrate that you have implemented a framework in your practice, a cybersecurity framework within your practice, and it's active and it's documented, which means it's an ongoing process, it creates a safe harbor for when, not if, but when you have a security incident. And if you have that and you have to report, they're going to ask you for that documentation, and that safe harbor reduces fines, it reduces audit times, it reduces all of your other documents that you have to submit. All you have to do is prove that you've had an ongoing program. And what's really cool is that most of I use the cybersecurity framework with my clients because it aligns with HIPAA and it's scalable. I have doctors tell me, oh, it's too expensive. There's too much involved. There really isn't. We use the cybersecurity framework in my home. And so it's scalable. It can be done in every practice. And I've been using it with my clients since 2015. So what the safe harbor did for me was it basically said I could come out a little bit and stop talking about HIPAA and really talk about cybersecurity in the practice, which is the whole meaning behind the security role in HIPAA. And it's required. the second item in HIPAA after the risk analysis is the security management plan. So we're just taking the security rule and giving it life.
Gotcha. So when it comes to HIPAA in general, and this is something that we didn't talk about ahead of time, but when there's a lot of unknowns about HIPAA in general, okay?
And a lot of misinformation is out there as well.
So, and that's what I wanted to, can you discuss some of the things that there's a lot of misinformation about, some of the most common misconceptions when it comes to HIPAA? That's what I wanted to get to, so.
Perfect. The biggest one that I see is that all you have to do is do your annual HIPAA training, and it can be with anybody, and that makes you compliant. Well, that's a fallacy because of the fact that there's two trainings under HIPAA. One is your security awareness training. What security awareness training should be is that training that teaches you about emails and about the security platform or the security landscape that we're in right now. But the biggest part of the training is on your written policies and procedures on how to handle patient information within your practice. This is an area that many practices, when they have to report, fail drastically because the very small amount of practices have a written employee manual, much less a written security manual. You need to have a written security manual in your practice that tells all of your team how to protect patient, how to have how to hire, how to terminate their access, how to release records to a patient, to another doctor, and how to send that through encrypted email, and what the process is, and that what if you're using Office 365 or whatever method you're using, what that process is, and that only certain people are allowed to do it in the practice. And when another doctor asks for records, you have to release that information right away. It's called continuity of care. And that's another law that's gone into play in 21 is the 21st Century Cures Act. And that's a whole different department in our government now that you have to answer to. So there's a lot of things that come into play. But the biggest misconception that we run across is that that we don't have to release records, that we have to have a patient come in and sign. That is absolutely incorrect. That we can charge for records. We can't anymore, and unless you're paper. And you can, under HIPAA, you can charge $6.50 if you are electronic. Under 21st Century Cures Act, you can't charge anything. So just make it your policy not to charge anything. But the two areas that are the biggest is the lack of risk analysis and the lack of written documentation. And they think that I've done my annual HIPAA training, I'm good. I had Stericycle come in and do it. We're good.
Gotcha. What about, and I get this question a lot. A patient wants their records. Okay. Mm-hmm. They call the office and says, I'm transferring to another provider. They have an outstanding bill. They still owe money. Doesn't matter. They have to send the records. They cannot refuse to send the records.
Right. So I'm a big proponent of collect at the time of service.
Of course.
But it's always amazing to me the offices that don't. But that's the ramification. You cannot withhold records because they owe you money. Now, if you want to send a ledger, that is part of the records. Send it, but you cannot withhold it. And under 21st Century Cures Act, you need to release that record as soon as possible. In fact, this year in 22, there's going to be even more changes coming. Right now, doctors have to release the records as quickly as possible by, I believe it's either October or December of this year, 22. They have to have a patient portal. If you go to your medical doctor, you have this patient portal that you can access. Well, welcome to the world of patient portals, which means now we're going to be looking at your website and pen testing your website because you're taking information about the patient, and that patient information is sitting now on your website. So it's going to be real interesting to see how these things unfold over the next few months here.
Do you need a written signature to release records now, or
No.
you don't need it? And that's a fallacy too.
Correct.
Yeah, it's funny you mentioned.
You have to have reasonable assurance that it's the person. So, most front desk people, they recognize the patient's voice. We have caller ID. If the patient is asking for the record, now the only time that I put extra requirements on is if the patient says to me, my husband is going to come pick up my records. Fine, what's your husband's name? And have him be prepared to show me his driver's license or some form of ID when he comes to pick up the records. But when you're releasing to another patient or to a patient, needs to be done right away. And if it's another doctor, whatever that doctor asks for is called continuity of care.
Gotcha. It's funny you mentioned about the online portals or the portal for the information. I just made an appointment with a podiatrist, and as soon as I made the appointment, I got a text message to have access to online information, and I went online. Now we have a portal too with my communication software where they have access as well. But I went online because I haven't made an appointment with a doctor in a while. But my records are all that, and I've never been there before, but literally because it's empty. But I have access to all my records immediately online if I wanted them.
As of May of 21, that information has to be available. What is kind of strange and kind of made us all sit back and go, what? Normally, they have you come out with the platforms first and then come up with this rule that says that you have to release. And the problem is that dentistry is a little bit behind on this. We haven't really had patient portals. There's only a couple of products that I'm aware of that have limited patient portals out there. But in the healthcare, in the medical doctor and hospital space, that has been out there literally since 2015. And as we work to bring all of healthcare under one platform, it's called interoperability, then you're going to start seeing more of this. But yes, as of May of 21, your records, your medical records are all out there. The only thing I've seen is that if you have a medical test done and you have an appointment to go in and get the results for that test, the office may hold back the results. Obviously you don't want to log in and see that you've been diagnosed with cancer before your doctor tells you. So there are some delays and there are some exceptions, but those are very minimal, and it has to be life-threatening basically for those minimal. And you have to think about what the reason behind the law is, and it is the whole concept of the reason here is continuity of healthcare.
Well, that makes a lot of sense. So before we move on to another topic, anything else on HIPAA that you think is important?
The safe harbor rule. This is sorry to keep harping on it, but it incentivizes practices to implement the security rule in their practice. And so many practices do not have they've not done a risk analysis. They have no written policies. They don't, right now with the hiring shortages, the way that they are, doctors are just any warm body. I've seen where a practice actually put in the teenage kid to answer the phone. Anybody can answer the phone. No, not anybody can answer the phone. And who are you giving access to? We need to take a step back and really think about those access controls. So for me, creating a safe harbor was what in a practice, I love doing it. I love helping the doctor and the staff to stop and think, because the things that we're implementing in the practice are best practices across the board. They're things that you should be doing in your practice, but guess what? They're things that you should be doing in your private life as well. And it's not just you, the doctor, you, the associate, it's your entire team. We are literally in a cyber war, and we are our best defense. So no one's going to protect our information like we protect it. So we have to stop and think. So it's about creating a culture of security. So no matter where you are, at work or at home, you stop, take a step back and think before you act, because hackers love it when we don't.
Of course. And that was going to be my next topic of conversation, was about hackers. There's been, at least maybe not for you, but for someone who's not in the space like I am, there seems to be a huge increase in ransomware attacks in the dental industry.
There has.
You see it all over the place. I've seen people post on Facebook, I have this ransomware attack, and they have my data. I have to pay for it. So, the threat seems to be incredibly high nowadays.
Yes.
Obviously, if you're using an IT company to protect your office, you should be protected against this. At least I'm hoping that's the case. But
nothing
maybe I'm
is 100%. Nothing is 100%. And we've seen IT companies get hacked. So there is it's layers of security. Nothing is 100% sure. Are they trying? Are they doing their best? There's, it's like anything else. There's some out there that are, there's some out there that aren't, but it's on the practice to determine that. And that's why, when it's a vendor, I always ask, what are you doing to secure the data? But your IT company is one layer of security. And yes, it does happen, but we have seen an uptick of hacks or attacks because we've all been in chaos since March of 20. Hackers love it when we're in chaos.
You're not paying attention.
Yeah, we're not paying attention. Between February 25th of 20 and March 25th of 20, there were over 500 websites created having to do with COVID-19 because everybody wanted to know what was going on with COVID-19. Out of those 500,000, the FBI estimates that over 50,000 of them contained malicious code. Even the Johns Hopkins COVID map, if you didn't click on it, the right one, the one you were looking at was downloading malicious code. So at the beginning of the pandemic, we saw the normal ransomware attack where somebody would drop the payload, which is what we call the malicious code, and it launches and you get your note. They're in the system maybe 5-10 minutes, if that. Starting in October of 2020, we started seeing what we call escalated attacks. So now what we're seeing is where data is exfiltrated. We're seeing where the hacker is in the system I have one client that I'm working with right now that they sat in the system for 48 days, waiting and doing reconnaissance. The average can be anywhere from 48. I've seen them as long as 210. They're watching your keystrokes. So there's some security things that we can do to counter that. But what we're seeing is data is exfiltrated. They're forget the dark web. They're posting it on the regular web. And we're seeing double and triple extortion. They extort the money out of you because you get that ransom note. Never ever pay. Never ever pay. Set yourself up in a security position so that when you get attacked, you just say, yeah, we're not paying, and you move on, and we do the right things. And I would like to come back to that one in a minute, but to stay on my mindset here, what we're seeing is data that you get that note. Well, then they want more money because it's all about getting money. So they contact you again and tell you, we've got your data. If you don't pay us, we're going to post it. And then you don't pay it. Well, then they start calling your patients. So it's best just to be proactive instead of on the defense. And what happens with so many of these practices is that this note happens. There's no plan in place. They start literally throwing the spaghetti at the wall and hope it sticks. And they make a lot of mistakes, costly mistakes because of it.
So we've seen an increase in the prevalence of these attacks, obviously, because we're paying attention to other things. A lot of people are not taking the appropriate steps to prevent it from happening. So to begin with, somebody's listening to this and they say, okay, I want to stop or decrease the ability for someone to do this. What are some of the things that someone should do to decrease the ability for a hacker to get the data in the first place, to hold the data at ransom?
So I mentioned that I work with that I use the framework that is NIST approved, National Institute of Standards and Technologies, called the Cybersecurity Framework. So you start by identifying what data needs to be protected. One thing that a lot of practices learned in 2021 is that there are other processes that are critical to the operation of the dental business that can get locked up. Everybody's backing up their patient data, but what are you doing about your QuickBooks? I had 5 or 6 doctors where the QuickBooks was on a local machine, not backed up, and their QuickBooks was compromised. It was locked up, and there wasn't anything anybody could do except for pay the ransom. And now what we're seeing is there's one gang of one group of hackers that if you negotiate or try to negotiate with them in any way, shape, or form, they're going to start posting your data. So again, it's best to be proactive instead of on the defense. But the things to do is it starts with identifying what information you need to protect, and then identify the potential risk to it. This is why a risk analysis is so critical and why they should be done annually, because your environment changes. Heck, even changing an employee is an environmental change. So you should be conducting a risk analysis on an annual basis. So you're identifying what data needs to be protected and what potential risks there are. Then you protect. You set the controls in place to protect the information that you've identified. You detect, you respond, you recover, you repeat. It's a continual circle. And so it's keeping the security and building a culture of security. And what I wanted to go back to the threat actors, and I said about throwing spaghetti. What's happening is because doctors don't have a plan, and I can tell you, and I sympathize, because the other service that we provide is incident response. When a practice has been hit with a cyber attack, we take the lead. We help them to navigate all the processes and all the requirements under HIPAA, as well as all 50 states now have a requirement as well. And so we help you to navigate how that works. And so what happens a lot of times is you're the first call that they make is to the IT or to some IT. I've had several recently where they were doing their own IT and they called the local IT guy to come in, and that IT starts wiping everything and restoring. They've got a backup and they start restoring everything. No, that is the wrong thing to do. You have a crime scene. The thing that you need to do is that you need to unplug the internet from all the devices. Do not power them down. Leave them as they are, because under HIPAA and under the states, you're required to do an investigation to determine what information. And I can tell you, now we get into the marketing. Now we get into reputation, right? Because now it's going to get out to our patients. You answer me. I'm going to ask you a question. Which is better, to send a patient a letter saying, oh my gosh, we've been hacked and your information is out there, or to be able to put a positive spin on it and send that letter out?
No, you want to be able to put a positive spin on things and say, hey, this happened, but guess what? We were protected and nothing happened and we're covered and blah, 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 blah.
Exactly. And what's happening is these IT companies are going in and they're wiping everything, and it removes the ability to meet HIPAA and meet the requirements and to conduct a forensic investigation. I actually just working with a client up in the Northeast, and the IT company that they called in told them, oh, nobody can tell you that information. That is Another myth, because I work with some of the best forensic teams in the country. They can tell you what time they entered. They can tell you what files they looked at. They can tell you what, because a lot of times what the hackers will do is they'll create new folders or new programs or applications. They'll tell you exactly what time all those things happen. They know their stuff. But what's happening is that the IT's going in and they're erasing. So it's about having a plan, which is part of your security management plan. You know, we're in Florida right now. We have these little storms that breeze in every once in a while. We call them names. I got a new roof with Irma. When we know a hurricane's coming, now living in Florida my entire life, I don't panic. I watch it and I evaluate what I need to do. And it's the same thing. You evaluate what you need to do. You make a plan to, okay, if we need to evacuate, we're going to do this. If we're going to write it out, we're going to do this. But we have a plan. Every practice should have a written disaster plan, including a cyber attack. And I can't stress this enough. Get a cyber insurance policy. A lot of especially the med mal practices right now, what they're doing is they're putting a little rider onto your med malpractice insurance. It covers $50,000 worth of coverage for the forensic investigation. Yeah, well, your forensic investigation is going to cost you about $35,000. So, and just to show you how it's increased. In March, April of 20, when they were just dropping the payload and going, it was roughly 12.5, maybe one of them was 14. But because now they're having to go through many more lines of code because they're having to narrow down exactly when they entered the system, it is about $35,000. So I recommend that everyone get cyber insurance standalone, where it covers your investigation. It covers the attorney that you're going to need to help with that investigation. It's going to cover your restoration, and it's going to cover your reporting. I've got several clients right now that are in the reporting phase. We've already reported. We've sent out that letter. We've put that positive spin on it. But there's a lot of things involved, and having somebody who knows the ins and outs is critical. Don't try to wing it just because that spaghetti to the wall, it becomes very, very costly. Because now if you haven't gone through the steps, now the states are coming at you because they see it as you tried to hide the attack instead of, hey, we were attacked, so was NSA. We have all this stuff in place. We're good. What do we do? And that's the point. That's the position we want to be in. We were good. We tried everything, and it still happened.
What do you think is the actual prevalence of an office getting hit with a cyber attack?
So think about this. Dentistry is the crown jewel. When a hacker realizes that there's a dentist and that he's gotten into a dental office, he is ecstatic because a hacker can recreate an entire individual with the information in a dental office. You have their demographic information. You have their oral health history, right? You have their dental insurance. So you have their employer and you have all this information. Now you have to file certain procedures to medical. I came out of perio, so almost everything we did had to go to medical. And you've always wanted to know, what are they on a bisphosphonate? Are they on a blood thinner before you take that tooth out? So we've always taken their medical history. If you go to the medical doctor, they may ask you, when was the last time you went to a dentist? But they're certainly not asking you for any details. The dental office is the crown jewel. So what happens is hackers, there's actually a team of hackers because we're seeing more organized crime and state-sponsored attacks than we are what we call the script kiddies. Those are the guys that are just hacking for fun. What we're seeing is organized crime where they're sitting literally in a room and China, Russia, New Delhi, and trying to hack you. But there's a whole division that their whole purpose is to research you, pull up names. Your information is already posted. Thank you, Equifax. And if you're part of T-Mobile, your information is already there. Let me go out and do a little Google of this person. Oh, he's on LinkedIn. Oh, he's the office. Let me just send him this email about the Cavatron special that we're having, or would you like to come to whatever state you're in, dental show we're going to. They're sending this email. A couple of weeks ago, there was I won't mention the name, but a prevalent dental supplier had to send out a letter because hackers had been contacting offices indicating that they were part of that company and that they were verifying, which this is really scary. They wanted to verify the logon credentials for that company's webpage. What's really scary is that they knew it was a dental office. They knew that that was a dental supplier, and they used that information to get practice credentials because everybody uses the same password. So it's,
You may have covered it, but I know you were talking a lot. I just want to confirm. If you are, I guess, if you do have a security incident take place or a cyber incident take place, what are the steps that you need to go through? Obviously, I know you said not to do. You don't contact the IT person. They don't wipe everything. I know you said to disconnect from the internet. But what are the first most important things you should do if you do have a cyber attack?
So the first thing you should do is you should disconnect from the internet and preserve your environment. The next best thing would be to call someone like myself, and there are several others in the industry that are incident response handlers or crisis management handlers that understand what you're going through, because I can tell you it's an emotional roller coaster there, because I've had offices that have been down for 2 months, and there's some workarounds. But that's why working with a crisis manager that understands what's happening in your office, we can create those workarounds and still meet HIPAA, still preserve, but still get you back up and running. Maybe not to full capacity and full production, but some production is better than no production. And that's where that insurance is going to come in, because it is a lot of the insurance companies now will pay for loss of production because you're going to be down. There's just no way around it. You're going to be down. I try to minimize with my clients. I try to have them minimally down 3, maybe a week, but no more. But it depends on each practice is different. And then obviously we're going to contact your insurance company. Most insurance companies have a bank of vendors that they work with. So we try to work within those so that we can maximize your insurance benefits. I was a treatment coordinator in an office. Does it sound familiar? We want to maximize your insurance benefit, but we also want to make sure that you are protected. And I will give you an example. I had a practice where we were reporting and the attorney drafted the letter to send out to the patients. And it was basically on August 15th, we were attacked. No. So I redrafted the letter and took great pains about, we take your patients, your information seriously, and we tried to do everything. And when this happened, we immediately contacted a crisis management incident handler, and we've contacted the FBI, and so we went through all these processes so that it looked like the office that had nothing in place, but it looked like they had done everything right. And one of the benefits of being with the FBI InfraGard, which is a collaboration between the FBI and private industry, is that I have agents that I work directly with that I can notify right away, and we can determine what courses of action do we want to take with the threat actor to determine how severe this attack is. So we try to attack it, for a lack of a better term, from various avenues and windows so that we can minimize the reputational and financial damage to the practice.
Yeah, because I'm sure that's the practice is going to be very in a state of
Panic.
Yeah, because obviously they haven't gone through it before in most cases, and they're concerned for both the status of the practice, but also the patient data is very much a concern. So everybody's going to be panicking. So I can understand that.
I've had conversations with doctors where, where are you? I'm on the server room floor crying. I know, I know this is devastating, but I also know I can get you through this. I can get you through this with minimal damage. And if we've got to report to your patients, we're gonna use that marketing, and we're gonna do it right, and we're gonna make it look good. But also, I want to minimize your exposure with the fines and the fees that will be coming at you. And the only way I can do that is that you have a working security management plan in place. I can't do 12 months of security management plan in 2 days. It has to be an ongoing process in order for that safe harbor to work. And so the quicker, it's New Year's, let's make our New Year's resolution to get cyber secure for 22, because that creates the safe harbor. It's not a matter of if, it is a matter of when.
So one last question for me, just so someone knows, I know you said that they should be doing in this annual compliance check. Mm-hmm. What is something that cost estimate for people who are?
It depends. There's actually ways you can do it free. If you go to HHS website, there is a free tool that you can use. It's very cumbersome. But they will tell you by their own admission that when you have an event that it may or may not stand up. The best process is to have an independent review, and it depends on the size of the practice and the amount of people involved and that kind of thing. When we do a risk analysis, we are in the practice for about 2.5 days. We are reviewing all of your documentation because HIPAA has 3 areas. So we review all of your administrative controls. We review all of your business associate agreements. We review all of your anything that falls under the administrative. We also do a physical review of your security posture. We're also scanning all of your devices, and so that we can see what the IT is doing. We also ask that you block off a 2-hour window for security awareness training for your team. And that's a mandatory meeting that you have put aside for your team to have that training, which is your annual HIPAA training. So you don't have to schedule anywhere else. But we also ask that you allow that 2 days that we can work with whoever you've delegated to be the security manager, to do the duties of the security manager, because we put them through a master class of what they need to do to implement the safe harbor in the practice. So we realize that there may be some patient interaction that has to be done for whatever reason, but we do ask that you minimize that so that we can work with that person and make sure that they understand the severity of what they need to do, how to do it. A lot of practices don't even have an idea how to write a policy or what a policy and procedure is. So we work with them on how to do that. We also, for 22, have a master class that we're putting on. I think we're going to do one here in Orlando, and I think we're going to try to do one in Virginia Beach area. But we haven't firmed up those dates yet, but it will be over the next few weeks.
Gotcha. Well, this was great. A lot of information given out. As the listeners and viewers know, I like to have a section at the end that's reserved to learn more about Debbie and some of the things she likes or dislikes. So I'm going to spend a couple minutes with you, Debbie, before we wrap up. Okay. Doing what's something called Would You Rather. Okay. So we're going to go through that, and then we'll do a wrap of the podcast, okay? So I'm going to read a question, give it the reason why, okay? So the first one, would you rather celebrate Christmas or Halloween all year round?
Oh, that for me, I actually celebrate Christmas all year round because I live in Christmas, Florida. So it is not uncommon for, in fact, I have several friends that keep their tree up all year round and they just change out the holidays. I get a live tree, so it won't work here, but I live in Christmas and so not Halloween town.
Okay, well, that's a great answer. Would you rather play Yahtzee or Scrabble?
Yahtzee. No brainer.
Yahtzee. No brainer. Okay. All right.
Scrabble takes my brain.
All right. Would you rather have your home be wall-to-wall mirrors or glow-in-the-dark paint?
Glow-in-the-dark paint. Mirrors, no.
So this is an interesting one. Would you rather smell like a dirty ashtray or sweaty gym socks?
Oh, sweaty gym socks. Jeez. No.
Would you rather sit in the front of a class or in the back of the class?
Oh, I am Baptist. I'm at the front. I'm in the Hallelujah
front of the class
section. Yeah.
Okay. All right. Interesting question. Would you rather have unlimited access to Warren Buffett or Charles Koch for advice?
You know, that's a hard one. I think Warren Buffett. I know a lot more about him than I do Charles Koch. I know that he's a very humble man. Actually, he still lives in the home that he purchased several years ago, and you know, I value his opinion. So I think that one.
Okay. All right. Let's see here. Would you rather have met Abraham Lincoln or Gandhi?
Oh, Abraham Lincoln. Absolutely. He did a lot of things at that point in time. So yeah, I'm Abraham Lincoln.
All right. Would you rather ride the scariest roller coaster in the world or bungee jump off the tallest bridge in the world?
Oh, well, okay. I'm not a bungee jumper. So, and I used to love roller coasters, but the older I get, they get more questionable, but I'm going to go with roller coasters.
Okay. So here's an interesting question. Would you rather give up all technology for a week or give up only social media for a month?
Okay, so I work in technology and my husband works in technology. Yeah, give it up for a week.
Okay.
You need that. Oh.
All right. So two more, and one is not on here. One I have a deck of cards that I used to read, okay. And I ask everybody that question. Let's see. I don't like that one. No, don't like that one either.
Oh.
Let's see. Would you rather have to do 100 jumping jacks or 100 push-ups?
Oh, jumping jacks.
Push-ups are hard. So.
Yeah, push-ups are hard.
All right. So this last one, I'm curious. Would you rather never be able to use search engines again, or never to be able to use smartphone apps again?
Oh, let's see here. You know, the ideal situation would be I'm a researcher, so I need I like the search engines. The ideal situation would be no apps. Unfortunately, we've become very dependent upon our apps. So I'm going to go with the research.
Okay. All right. Well, that wraps the Would You Rather part of the section. So before we finalize things, is there anything else that you wanted to mention to the listeners or viewers?
Nope. Just make your New Year's resolution to become cyber secure.
Okay. So if anybody wanted to get a hold of you, what's the best way? Is there anything you wanted to offer the listeners or viewers?
Yes. A lot of practices are unsure whether they have a security plan in place. So we are offering 1 hour of consultation to kind of review with you where you are and go from there. And how to contact me is the best way is by email, and that would be info at DK Carr, Carr, like you drive, add an extra R.com, or our phone number, which is DK Carr 1. 844 DK Carr 1.
844 DK Carr 1.
Mm-hmm.
Perfect. So, guys, I hope you learned a lot during this episode. I certainly did. If you have any questions for Debbie, please reach out. If you enjoyed this episode, please share it with your colleagues. Please let them know to listen to it. Remember, we come out Fridays, 1 p.m. Eastern time is when the episodes release. Please subscribe to the episodes. Let me know if you have a guest you want me to reach out to. I'm happy to interview anybody for this podcast. I hope you enjoyed it. Again, Happy New Year. First episode of the season number 5. Debbie, thank you for joining me today. You're a fabulous guest. Loads and loads of information. And as I always end these episodes, remember, your reputation matters. Until the next episode, guys, have a great day. Happy New Year, and we'll speak with you soon.
Thank you.